Hi class, this is Dr. Shahada, and in this video I will be reviewing Chapter 7 from our required textbook for this course on outpatient and primary care services. So right now I am in the module for this week. So as you can see, we have, okay, there it is, a PowerPoint presentation, which I'm going to touch on a couple of things in the PowerPoint, aspects or topics covered. I'm not going to be going through the full PowerPoint presentation since a lot of the slides are very, are self-explanatory. I do want to strongly advise everyone to take the time to read the full chapter and go through all the slides from the PowerPoint presentation. I also have another file that lists the terms from the chapter as well as the definitions. So we're going to be talking about outpatient and primary care services. So let's begin here with this table on primary care. So first, primary care is the care that's provided by physicians specifically trained for and skilled in comprehensive first contact and continuing care for persons with any undiagnosed sign, symptom, or health concern. Primary care includes health promotion, disease prevention, health maintenance, counseling, patient education, diagnosis, and treatment of acute and chronic illnesses in a variety of healthcare settings. So that includes critical care, long-term care, home care, day care. Primary care is performed and managed by a personal physician, often collaborating with other health professionals and utilizing consultation or referral as appropriate. Now, referrals for specialized services, again, are made by PCPs. One of the main functions of primary care is to coordinate the delivery of health services between the patient and the MyRad delivery components of the system. So in addition to providing basic services, primary care professionals serve the role of patient advisor, advocate, and system gatekeeper. So in this coordinating role, the provider refers patients to sources of specialized care, gives advice regarding various diagnoses and therapies, discusses treatment options, and provides continuing care over time. So coordination of an individual's total healthcare needs is meant to ensure continuity and comprehensiveness. Now, primary care is comprehensive because, again, it addresses any health problem at any given stage of a patient's life cycle. Primary health care is regarded as essential health care. So keep that in mind because that is touched on in the PowerPoint presentation. The goal of the health delivery system is to optimize population health, not just the health of individuals who have the means to access health services. So achievement of this goal requires that disparities across population subgroups be minimized to ensure equal access. All right, now let's go to the next row. Primary care practice. Again, primary care practice serves as the patient's first point of entry into the healthcare system and as the continuing focal point for all needed healthcare services. The following row covers primary care physician, who is a specialist in the area of family medicine, internal medicine, or pediatrics, who provides definitive care to the undifferentiated patient at the point of first contact and takes continuing responsibility for providing the patient's comprehensive care. Now, this type of care, I jumped down here. This type of care includes chronic, preventative, and acute care in both inpatient and outpatient settings. The next row we have our NPPs, or non-physician primary care providers. So there are providers of health care other than physicians who render some primary care services. Such providers may include nurse practitioners, physician assistants, and some other healthcare providers. All right. So before I continue on, I'm going to be going to the PowerPoint slides, since I'll be covering most of these topics that are listed here in this week's module in the PowerPoint presentation. So I'm going to jump over to Chapter 7's PowerPoint presentation. All right, let's go. All right, so here we are. This is slide number 3 in the PowerPoint presentation that is provided to you in this week's module. First, I'd like to begin by defining what outpatient services are. Now, an outpatient service does not require an overnight inpatient stay in an institution of healthcare delivery. So that means the patient has the procedure done and goes home and doesn't stay in a hospital or a long-term care facility. Now, I do want you to also be aware that when we say ambulatory care, it is the same or interchangeable with outpatient services. So let's begin here. So outpatient services existed before hospitals and nursing homes. So in the earlier days, you had physicians that saw patients in their clinics, or they would actually do home visits to treat patients. Of course, within the limitations of medical science in those days. So with the advances in medical science, we saw this, the almshouses and pest houses that were slowly transformed into hospitals. Now, as the range of services provided on an outpatient basis continued to expand, we found hospitals going through a decline regarding their occupancy rate. So hospital executives had been forced to kind of view ambulatory care as an essential portion of their overall healthcare business, rather than a supplemental product line on an inpatient facility. So seeing their inpatient business erode, hospital administrators have realized that establishing a firm position in outpatient care market or ambulatory care market is critical to the continued survival of their organizations. So to meet the growing demand for outpatient services, hospitals have expanded into services that previously were not considered a part of their core business. So the growth of non-hospital-based ambulatory services has intensified this competition for outpatient medical services between hospitals and community-based providers. So an example of this would be home health care and ambulatory clinics for routine and urgent care. And we even have medical malls that began to exist. Now, on this slide, I wanted to touch on the topic of ambulatory care, which all primary care is ambulatory care. But not all ambulatory care services represent primary care. And I just really wanted to touch on that difference. So one of the goals of primary care is to bring healthcare as close as possible to where people live and work. Hence, all primary care services are ambulatory in nature. In other words, true primary care is community-based. It represents convenience and easy accessibility. The term ambulatory care is used interchangeably with outpatient services. So primary care is delivered on an outpatient basis and is therefore ambulatory. However, the scope of ambulatory services extends beyond primary care. For example, hospital emergency departments and trauma centers, right? They provide secondary and tertiary care. Outpatient surgery and rehabilitative therapies are also examples of ambulatory services that are not primary care. Okay, so there are certain tertiary treatments. Again, another example would be renal dialysis or chemotherapy that are commonly rendered in outpatient settings but are not considered primary care. So as I said, ambulatory care and outpatient care, we can use them interchangeably. but you can't use ambulatory care and primary care interchangeably. So make sure to keep that in mind, okay? Now I am going to jump to slide 6. So what is outpatient care? Again, ambulatory and outpatient care are used interchangeably. So ambulatory care constitute diagnostic and therapeutic services and treatments provided to the walking patient. Primary care is the foundation of ambulatory health services. Now, when we say outpatient, again, I know I defined it earlier, refers to any healthcare service that does not require an overnight stay in a healthcare delivery institution. Primary care is integrated healthcare services by clinicians who are accountable for addressing personal healthcare needs, developing a partnership with patients, and practicing in the context of family and community. Now, in this chapter, we are going to be going over two different definitions for primary care. One is by the World Health Organization, WHO, and the other one is by the Institute of Medicine, or IOM. Now, WHO's definition is essential healthcare that is based on practical, scientifically sound, and socially acceptable methods and technology. So let's look at different elements of this definition. So accessible to community in an acceptable way, cost is fair for an individual, and it's the first level of contact between individuals and the healthcare system. Now there's 3 noteworthy elements: point of entry, coordination of care, and essential care. So point of entry, the ideal process is first contact, allows gatekeeping. Now, when I use the word gatekeeping, I want to make sure that we're all on the same page of gatekeeping's role in primary care. So in a gatekeeping system, patients do not visit specialists without a referral from their primary care physician. On the surface, gatekeeping may appear to be a controlling mechanism for denying needed care. So in most cases, the interposition of primary care protects patients from unnecessary procedures and overtreatment. So this is because specialists are much greater users of tests and procedures, and such interventions carry a definite risk of iatrogenic complications. Gatekeeping must emphasize the coordinating role of primary care to ensure comprehensiveness and continuity of care. Now, an ideal process of point of entry includes it protects the patients from unnecessary procedures and overtreatment. Community-based, so it's widely available everywhere, routine, inexpensive, and appropriate technology. Can refer on for expensive procedures. Okay, so that would where the referrals come into play. Now, issues with the current process. Well, gatekeeping may not work because there's not enough PCPs. Again, we have a shortage going on. Lack of PCPs may cause system to malfunction, thus denying treatment. Lack of PCPs may lead patients to get unnecessary treatment anyway, which is going on at the moment. And it's not widely available, so it may be very costly. Now, when looking at coordination of care, we have primary care clinicians that are advisors and advocates. Again, refer out to specialized care. They advise on diagnoses and therapies, discuss treatment options, and they're there for the continuing care or chronic conditions, and they're also responsible for that continuity and comprehensiveness in care. So here's a little diagram kind of giving the idea of that coordination role for primary care. Now, does primary care work? Yes, it does. Countries with primary care orientation have better health levels, higher satisfaction with health services, and lower expenditures overall. Now, weak primary care infrastructures are associated with poorer health and higher costs. In the U.S., states with higher PCP patient ratio and better availability of primary care have better health and lower hospitalization for PC issues. All right, so now I'm on slide number 18 on essential care. Primary care equals essential care, meaning that it leads to the optimization of not just an individual's health, but population health. We are looking at a community level. It requires minimization of disparities. And again, financing the key element to healthcare, which is primary care, without national financing in the U.S. is difficult. Now, I am going to jump to the slide on the Institute of Medicine's definition for primary care. All right, so now I'm going to be speaking about the definition for primary care by the Institute of Medicine. So the IOM Committee on the Future of Primary Care came up with their definition, and it was preferred, but not only, it talked about primary care being preferred, but not the only route of entry into the healthcare system. So here is the exact definition. So it's the provision of integrated, accessible healthcare services by clinicians who are accountable for addressing a majority of personal healthcare needs, developing a sustained partnership with patients, and practicing in the context of family and community. So here is a diagram that talks about this integrated care of primary care. So we have accessibility, continuity, coordinated, and comprehensive. So there's 4 elements that are really brought up in IOM's definition. So both patients and PCPs have accountability. They may not be equal, and here's a little scale. It does change over time, but there's mutual trust, respect, and responsibility. Now, I do want you to keep in mind that both definitions, the one from WHO and IOM, actually overlap. So their domains overlap regarding point of entry, coordination of care, essential care, integrated care, and accountability. Now, I want to briefly touch on primary care, secondary care, and tertiary care. Now, primary care is the prevention, diagnostic, therapeutic services, as well as health education and minor surgery. So primary care is the approach to providing health care with the first level of care. Now we look at secondary care, which is short term. So we're looking at more sporadic consultation with a specialist for advanced interventions not available in the area of primary care. Tertiary care is for conditions that are relatively uncommon. So we're looking at institution-based care. It's very highly specialized. Now, the next topic we are going to be touching on is the medical home. Now, this is actually a video which you can just press on your control key while you click it. If you have an internet connection, you should be able to be taken to the video. Now, a medical home is an interdisciplinary team of physicians and allied health professionals who partner with patients and their families. They take responsibility for ongoing patient care, technology, evidence-based protocols to coordinate and provide care. So this term was actually coined in 1967, and medical homes are actually established for special needs children whose health required constant coordination. Now, I'm going to jump to slide number 31, and we're going to address the topic of community-oriented primary care. So community-oriented primary care is really based on the concept of the ecology of medical care, which really focuses on the relations between the population and the community. Now, COPC also incorporates the main idea of what WHO and IOM, or Institute of Medicine, proposed in their definitions of what primary care is. So COPC, or community-oriented primary care, really incorporates, again, the elements of good primary care delivery. It adds to the population-based approach to identifying and addressing community health problems. Now, it is based on a biopsychosocial paradigm, which is broader in scope than the traditional medical model that's been followed. Now, a system of healthcare delivery that's based on a community-oriented primary care approach really involves 4 areas of development, okay? Now, the first one is that primary care really has to take a central role in the delivery of health services. Second, the biomedical model that has dominated both research and health professions education must be broadened. It needs to include a stronger element of the social and behavioral sciences. So this is where public health kind of comes in. Then we have a third development that, third element that really needs to be developed if we were going to follow this community-oriented primary care approach. And it can't be achieved without appropriately linking primary and secondary prevention in clinical settings with population-based health programs. So this is because primary and secondary prevention, as well as having certain aspects of tertiary prevention, are essential elements of primary care. So we have primary and secondary prevention that are essential, have essential elements of primary care, and there are certain aspects of tertiary care as well. Now, the fourth element that would need to be developed is the strengthening of public health functions as an adjunct to clinical interventions. And this is because most population-based health problems cannot be dealt with by clinicians alone because they really focus on individual care. So we have community organizations such as schools, social service agencies, churches, and employers that must become partners in strengthening public health programs. So I wanted to touch on that topic just to kind of give you an idea of what community-oriented primary care is, and if such an approach was to be taken, where there's a healthcare delivery system that's based on this type of approach, these are the elements that would need to be taken into account. And this is really what really caught my attention with community-oriented primary care, is it really takes medicine and public health where they actually need to be integrated in order for it to function, and that really gives us effective primary care where we're addressing health issues on the individual as well as on the community level. All right, so now I'm going to be jumping to the topic of hospital-based outpatient care services. So just give me a moment to get to slide 41. Make sure to go through the rest of the slides, not just the ones that I'm pointing out in this video. All right, so we have 5 main types of hospital-based outpatient care. First is clinical services. So clinical services often correspond to the services provided by private physicians in their offices. Hospitals located in underserved areas often provide ambulatory services to patients who lack health insurance and do not have routine access to private practitioners. So these are centers that are affiliated with teaching hospitals, and they provide research-oriented specialized services. Some large teaching hospitals may have 100 or more specialty and subspecialty clinics. Then we have surgical services. These are also hospital-based ambulatory surgery centers. They provide same-day surgical care. The surgical clinic group may include general surgery, orthopedics, urology, plastic surgery, and rehabilitation. A surgical care center is usually episodic and short-term. So surgical care is usually episodic and short-term. Then we have emergency services. So the emergency department has been a vital outpatient component of most community hospitals. The main purpose of this department is to have services available around the clock for patients who are acutely ill or injured, particularly for those with a serious or life-threatening condition requiring immediate attention. So the emergency department also offers prompt hospitalization if needed. I do want to point out with ERs, emergency rooms, or EDs, emergency departments, they tend to be overutilized, and I'm sure you've noticed that from the previous chapters that we've covered in our textbook. Now, the next slide, we are going to touch on home health care. So home health care includes many hospitals that have opened separate home health departments, and they provide mainly post-acute care and rehabilitation therapies. Hospitals have entered the home health business to keep discharged patients within the hospital system. And we also have women's health centers. So these centers specialize in meeting the healthcare needs of women. They've been around since the 1980s, and the emerging recognition of the prominence of women as a major health market has led medical institutions to develop specialized women's health centers in hospital-based and or hospital-affiliated settings. So in addition to services in obstetrics, gynecology, and primary care, women's health centers offer mammography, ultrasound, osteoporosis screening, and other health screenings. Specialized inpatient programs for women in the form of special units, pavilions, and women's hospitals are also in operation. Now I'm going to be going back to this week's module, the Some Information from the Chapter section. And I do want to make sure that you guys go through the rest of this PowerPoint presentation. Make sure to read the full chapter, and especially make sure to really understand what the Emergency Medical Treatment and Labor Act of 1986 is. All right, now I'm going to be going back to this week's module. So let me do that now. All right, so here we are. We addressed most of these topics. Reasons for growth. All right, so let me scroll a little further down, looking at outpatient services, which we touched upon. And last, types of primary care, primary, secondary, and tertiary. All right, so I tried to cover the chapter in a short video. I did not want to leave it to be too long. I wanted to touch on a couple of the topics, but again, my slides are pretty self-explanatory. And remember, you could add more information to my slides. I have no problem with that. I know you'll be using them on your exam, as long as they're just little notes throughout, since you're going to be downloading it. I have no problem with that. That'll help trigger your memory. And if you have any questions, be sure to let me know. Don't hesitate to email me. That's what I'm here for, okay? Take care, everyone. Bye.